Assalamu alaikum. Today our lecture is mounting. Mounting is the laboratory procedure of attaching the maxillary or mandibular cast to an articulator or similar tool. Preparation of articulator before mounting procedure. In case of using value type articulator class 2 with fixed condylar, bath and incisor neckline, the articulator should be clean from any remnant of previous plaster. The incisal pin positioned with the top of upper member of articulator to give zero reading. The mounting table properly fixed to the articulator member. For dentatus articulator, the maxillary model with its record base and occlusal rim that's secured to the cast accurately by wax. Mounted first on upper member by using of the face bow, which supported upper occlusion rim to its accurate position during mounting. Preparation casts for mounting on the articulator. Step 1. Determine the midline of the cast according to the incisive papilla and continue this line posteriorly all around the cast. Step 2. By using the plaster knife or by hand piece with metal burr to make 3 to 4 V-shaped cuts on the base of upper and lower casts that used as mounting index to facilitate the remounting after construction final denture. The index cuts should be approximately quarter inch in depth and half inch in width. Then the base of the casts and the index cuts are lightly coated with Vaseline or any separating medium. Step 3. The base plate with occlusion rim sealed to the cast by wax. Step 4. Alignment the midline of upper occlusion rim to the center of the crossed midline which found on the mounting table anteriorly and posteriorly, so that the cast will be centralized to the mounting table and the occlusion rim fixed to the mounting table by wax. Step 5. Enough space should be present between the base of the cast and the upper member of the articulator to accommodate for the plaster material over the cast. If there is no enough space, trimming should be done to the cast base. Step 6. Plaster is mixed according to the correct water-plaster ratio. Then the plaster is poured over the base of the upper cast and the upper member is closed until the incisal pin touches the incisal table. Step 7. Smoothing and polishing of the plaster is done. The mounting should be cleaned and any debris is removed from the articulator. Mounting the lower cast. The center regulation is taken from patient mouth. The lower occlusion rim should be well secured to the lower cast with its record base by the using of the wax. Sealing should be done between the upper and lower occlusion rims. Care should be taken that there is no posterior interference between the upper and lower cast healers area. Plaster is mixed and poured over the base of the lower cast and the articulator is closed until the incisal pin touches the incisal table. Then the plaster should be smooth and polished. After setting of plaster, the following point should be checked. Number 1. The midline of upper cast should be coincide with the midline of lower cast and midline of articulator. Number 2. Centralization of upper cast with upper member of articulator. Then the centralization of lower cast, which depend on accuracy of the upper cast. Number 3. Incisal pin check if it doesn't touch the incisal table. Healer's area checked if there is any contact. Errors occurred during mounting. Number 1. The record base is not properly secured to the cast. Number 2. Interference of the cast posteriorly. Number 3. The incisal pin is not properly screwed. Number 4. the incisal pin not touching the incisal table. Number 5. Wrong transfer of the midline of the articulator with that of the cast, that means shifting of the midline. Number 6. Movement of the casts during mounting. Number 7. Upper and lower occlusion rims are not properly fixed for orientation. Number 8. Dimensional changes in the plaster. Lastly, faceboard cord defect when use the semi-adjustable articulator.